But first, I am delighted to introduce someone who will be a familiar face to many of you in this room through her long and outstanding track record as a global health leader. Adding to her vast list of roles and experience, she's recently been appointed as CEO of Gavi, the Vaccine Alliance. She has over 3 decades working in public health in both Pakistan and internationally, although I have to say she doesn't look like it. She was Pakistan's first female cardiologist and served as senator in her home country. She is the former chair of several multilateral initiatives, and she's been listed, not surprisingly, amongst the world's 100 most influential women. She is a tireless advocate of health equity. Please welcome Dr. Sania Nishtar.
Thank you, Julie, for that very kind introduction. Let me begin by thanking IFPMA for having me here, and I want to congratulate you, David, on your role. I'm glad to know there's someone who's even newer in the role than I am, because I'm 9 weeks old, and I was just sharing with my colleague that I've already been to 10 countries, so it's been quite a whirlwind for me. Once again, thank you, IFPMA, for having me here. You are a very important partner for global health. Your innovations have enabled us to celebrate the 50th anniversary of vaccination, which is the event I'm going to just now. And congratulations to all of you. Without your innovation, without the science that you have transformed into vaccines, we wouldn't be having that celebration in WHO today. So I think it's important to recognize that. But it's also important to recognize that this is a very challenging time for global health. And I saw the word collaboration on your, prior to when my picture appeared there, I saw collaboration on the slide. There is a very clear imperative for collaboration, not because it's a nice thing to do, but because there is a very serious imperative. As the CEO of Gavi, just having kicked off our drive towards replenishment, which is the word for fundraising in our parlance, I've deeply engaged with donor governments, with donor capitals. I'm just coming from the G7 finance ministers meeting in Streza. I have spoken to civil society advocates in our donor communities. I've spoken to governments, to health ministers, to finance ministers, to central bank governors. And I can tell you that this is a very resource-constrained time for global health. There are a number of competing priorities. There are ongoing conflicts in different parts of the world. The G7 donors are very stretched with capacity, their own macroeconomic situations, the competing political priorities, the internal macroeconomic situations, the internal demands with regards to repurposing part of the ODA for incoming refugees is really crowding out space for global health. And we in the global health ecosystem, of which we are a small part, must hear this loud and clear. This is also a time when the value of the multilateral system is being questioned, and it is being questioned very openly. And this is a time where many of us are going on the replenishment drive. It is our sister agency and our WHO, it is Gavi, it is next the Global Fund in the line, there's IDA. And my last 9 weeks have been spent on many things, but one of them has been to prepare for the kickoff of our replenishment drive. And I have to tell you, the landscape looks very fiscally constrained, which is a long-winded way of saying that we really need to collaborate. We need to collaborate concretely, and we need to collaborate with some very clear endpoints. there is a country dimension to this as well. And if I put my hat of the former Minister of Social Protection in the government of Pakistan, and I'm sharing this over and over again as I go to sessions, the biggest department that I ran was a department that dealt with donor entities, because each one of them had different frameworks, had different reporting requirements, had different indicators, had different procurement systems, compliance asks. Each one of them had specific audit requests, and a very large part of my time as a cabinet member was spent responding to those requests. So as I went to Africa in my new role with my Gavi hat, and when the ministers raised the concerns about the fragmentation that exists within our landscape, when they raised the imperative to collaborate better, I could relate with them perfectly. We are hearing voices from Africa for the very right reasons, that they are sovereign countries, that we must respect them, and that we must go to them with one voice and with one channel of external assistance. And I think with that voice coming from the other side, and with the internal resource constraints that we are looking at, and the imperative to collaborate, this World Health Assembly has to clearly signal that we will work together, because we really have no choice. So let me come to Gavi now. 9 weeks into the role, I want to pay rich tribute to my predecessor, Seth Berkley. I think he has brought the organization to where it is today. He's done a remarkable job. This is an organization with a very unique model. It's a public-private partnership. It's vaccinated over 1 billion children with routine immunization, 6 billion during campaigns, 2 billion during COVID-19. It executes at a very low operating cost. The model is resilient. It came into operations during COVID-19, took over, operated in 146 countries, practically within a matter of a few months, was able to scale up its operations. And it is one of the few, I would say, perhaps the leading global health institution which works not on a charity model, but with a clear path to sustainability. 19 countries out of our ecosystem have already graduated, and the model is such that countries co-pay and progressively have an ownership as they go forward. And the industry has had a very important role to play within the Gavi ecosystem, because this is one of the few global health institutions where the role of the industry is integral to the execution that Gavi does. Together, Gavi works with you, has a market-shaping objective, assists with catalyzing the development of new vaccines, and then when the innovation ecosystem works at your end and comes up with new vaccines, transformative vaccines such as PCV and the malaria vaccine, which is, and hopefully the tuberculosis vaccine, which is around the corner, and HPV, we are the engine which bring this to the world, to the most underprivileged populations, working together with our partners on ground, WHO and UNICEF. It's a model that is delivering on the ground. It's an engine that works. And as an incoming CEO, because I've been in institutions where I've had to work on reform from day one on some systemic fault lines. That's not the case over here. It's an institution that is delivering, which is working fairly well. But as a new CEO, I have looked at things critically, and my 6-month priorities plan will shortly be released. One of the priorities within the 6-month plan is to work better at the delivery end, because at the delivery end, we have systems constraints, and those systems constraints hamper our ability to deliver in certain situations, which is where I will focus as a priority. I will also, as part of my 6-month plan, announce a number of new initiatives to focus on innovations and to catalyze the innovation ecosystem, not just on the delivery side, but also on the vaccine side, and further details will be shared with you shortly. But coming back to partnerships, as I mentioned, partnerships are within the DNA of the Gavi Alliance, and as I mentioned, we work with WHO and UNICEF on the ground. They are integral to the Gavi Alliance. We work with the industry very closely and collaboratively. And then there are a number of new partnerships on which I, as the incoming CEO, will work on a fast-track basis. And one of them is the partnership with the Global Fund. Because Gavi and the Global Fund have our end products at the same primary health care facility. We work through the same systems, we interface with the same ministries, we work with the same governments. We have the same country teams, and we sit in the same building. But there is potential to further build synergy. The new malaria vaccine is a case in point. At the country level, there is a national immunization institutional system, and then there's a corresponding malaria execution, normative and execution institutional system. There are two agencies out of Geneva, out of the same building, interfacing with those two ecosystems within the same country, trying to get their products into the same primary healthcare facility through the same pipe. And to a woman who goes to a health facility to have her child with fever, child wants to get vaccinated, and she wants access to malaria prevention and tuberculosis drugs, it doesn't matter who we are and how we operate in Geneva. That woman is not interested in me as the CEO of Gavi, is not interested in WHO and Peter Sands at the Global Fund. She's interested in the products to be delivered to her safely, in a timely manner, in a respectful manner, and for her not to navigate the abuse and the informal payments that exist within those ecosystems. And we, as the donor community, need to collaborate better to ensure that we have our collective leverage in favor of those systemic solutions that exist in the private world. And we need to bring them to the public world and to the public system. And I think that beyond the innovations in vaccines, we have a lot to learn from the private sector with regard to their ways of working, with regard to their ways of execution, and it's some of those execution capabilities that we can bring on the delivery side as well. So there is this piece about collaboration with the Global Fund on which we're excited, on which we're moving very proactively. And in my 9 weeks of being in Geneva, let me tell you, I have met Peter Sands 9 times. And we are very proactive in shepherding a working agenda which is in the final stages of being preparing. Coordination at the back-end Geneva office, coordination at the back-end office within the countries, collaboration around the malaria vaccines with clearly an endpoint in mind, which we might not reach very quickly, but an endpoint centered around a common application at the country-facing level. And then, of course, working towards an ecosystem where we will be more collaborative, assuming that the tuberculosis vaccine is on the anvil. There is also, of course, dimension to collaboration with regards to emergencies and outbreaks. That is where WHO is our big sister, and we look to WHO for stewardship, for guidance. Gavi has a certain role to play, and we definitely, under my 6-month plan, there is a component related to bringing clarity to our role and to preparing for that role better during outbreaks and emergencies. And I can go on and on and on with the potential for collaboration within the global health space For instance, when I drive to my office, the ITU is on the left side. There is going to be a new AI initiative as part of my 6-month plan, and we clearly can leverage on their expertise for that, overcoming the need to create capacity within the institution. There clearly are departments within WHO that deal with health systems far better than us, and we can clearly capitalize on sharing of experiences. I come from the world of NCDs. As a former cardiologist, I know that in every city of every country, there is a cardiology association and a diabetes association and a cancer association, and that members of the IFPMA are deeply hooked into these communities, are deeply engaged, that there is an apex alliance called the NCD Alliance, and it wouldn't make sense for us not to leverage that ecosystem when we are pushing the HPV vaccine, which is the product of your innovation, which we, through the leverage of our partners, bring to disadvantaged communities. What I'm trying to say is that there has to be a mindset shift in the way we approach partnerships. And all of us have a role to play. Problems do not come with solutions, with packages, with the names of institutional entities written on them. Solutions can only be found when we have to work together. And we can only work together when we let go of ego and turf and rivalries and small thinking, when we start thinking big in the interest of people and the interest of very disadvantaged people. That was my first lesson which I learned when I worked in the government and had responsibility for bringing welfare to 100 billion people. I learned that it was only through cross-departmental collaboration and working with the private sector, because there are many competencies that the public system does not have. There are many competencies that governments don't have, that international agencies don't have, and those competencies exist within the framework of the private sector. We just need to change the way we do things in countries. And this has to begin with a change of mindset. And I'm very committed to ensuring that we move on this path. I want to thank you once again for having me here. I want to thank you once again for the welcome. And I want to thank you once again for putting collaboration right up front on your, at the center of your event, because that is the key to moving forward. That is the key to, that is the key to bringing solutions. And just before I get off the stage, I also want to let you know that Gavi as an institution is currently on a twin path of change. Our strategy process is on the is currently on the anvil, and the replenishment drive is going to kick off on the 20th of June in an event in Paris. And we really look forward to celebrating those moments and celebrating our partnership and to collaborating even further for the larger good of the poorest people around the world. Thank you very much.
Thank you. Thank you very much indeed, Dr. Nishtar, and that's such a great message. Let go of small-mindedness and start to think big. Thank you. Thank you very much indeed for that.